Let's move on to other news. We go to Europe, where the use of Oxford-AstraZeneca's vaccine has been paused in 11 European countries after a small number of blood clots were reported among people who had recently had the jab. Germany, France, Italy and Spain are among the latest to suspend its use. The World Health Organization is investigating the reports but says there's no evidence that the clots are linked to the vaccine. Lucy Huff joins us now from Brussels. So, Lucy, tell us about where you are and what the response has been in Belgium.
Well, the response from Belgium has been slightly different to other European nations. It's part of a handful of countries, very much the minority, who've decided to press ahead with their vaccine rollout of the Oxford-AstraZeneca jab, saying that it would be more risky to halt the campaign at this point. One leading virologist said that the risk of COVID-19 was still too great, that stopping the rollout of this specific vaccine could lead to more hospitalizations and deaths. So that's the position of Belgium, but neighbouring France, the Netherlands, Germany taking very, very different approach to this. They have suspended temporarily the rollout of this vaccine due to concerns about severe side effects, namely blood clotting and bleeding, which has been reported in around 40 cases. But to contextualise, 17 million people in European countries, including the United Kingdom, have received this jab. So we are talking about a tiny minority of cases, but nonetheless one serious enough that the EU's health regulator, the European Medicines Agency, says that it will be poring over data files and information filed by individual member states to assess the safety of the vaccine. It will be announcing the decision from that investigation on Thursday, but certainly this is yet further disruption to a campaign in Europe that has already been beset with problems.
So, I mean, we had just up there the statement from AstraZeneca, but I'm curious as to this decision to suspend the use of the vaccine. Is it because, you know, these European countries enjoy the privilege of having access to vaccines, so they have alternatives, or is it because there are serious preliminary findings that these blood clots are not a usual occurrence, that they are directly linked to AstraZeneca's vaccine?
Well, that's certainly the allegation, but AstraZeneca has said that there have been other incidents of blood clotting, which they say these numbers are nothing unusual in a mass vaccination campaign like this, that these are blood clots that would have likely occurred in the general population and are not in fact caused by receiving the dose. But certainly there is, particularly with the AstraZeneca vaccine, there is a political element to all of this, one I'm sure that would be denied by EU national governments. But there have been a number of problems with the relationship between the EU and AstraZeneca. That slashing of delivery targets in February that caused a furious row, the publication of redacted contracts that then spilled over to tensions with the United Kingdom, where the vaccine was developed at Oxford University. There was then the decision of European governments to restrict the dose in the over 65s due to a lack of data in the vaccine's clinical trials. That was a decision that was then reversed. So we are seeing this as perhaps an extension of what has already been a difficult and at times political relationship. But if indeed the European Medicines Agency comes out with a verdict that it is sure about the safety of this vaccine, that this is a very, very, very small number of cases when millions of people have received this dose, then we could see that decision reversed. But you mentioned other vaccines there. I mean, we are still experiencing shortages in relative terms of what the EU signed up from all three, now 4 vaccines authorised for use in the bloc. So there is still a problem of supply, but you'll know that the AstraZeneca shot is playing a huge and crucial role in the COVAX facility that of course aims for fair distribution with low and middle income countries. If indeed there is this crisis of confidence here with that vaccine, then that could have an impact in the wider rollout of the vaccine worldwide.
And the World Health Organization is obviously encouraging continued use of this, saying that there's been no proof as as yet. So country context is important as well, as you've just mentioned. So just tell us about the recipients of the vaccines, when they receive the vaccine. And I know there are some portals that keep up research on the reactions to it, but is there any immediate recourse they have should they feel that what they experience is as a result of being vaccinated?
Yeah, absolutely. I mean, there are vaccine regulators in all of the EU 27, and it was Austria's health regulator that first picked up on these unusual cases of blood clotting that it then flagged, and that led to one of the first European suspensions in a particular batch of the Oxford-AstraZeneca vaccine. Italy then went along similar lines, but Denmark was the first to go ahead with a full 14-day suspension based on information that it was getting from its the people that have received the dose within its population. Norway, again, it was a similar thing. So what the overall EU health regulator will be doing now is looking at all the data from all of those EU 27 health regulators to assess why those decisions were made, what sort of reactions we're seeing, and how those proportions compare with the amount of people that have received this dose. I mean, we're talking about around 6 million people on mainland Europe that have been given this vaccine, and around 40 people who've had these adverse side effects. But as you mentioned earlier, the WHO is saying that these are really nothing unusual, that this is a very small percentage of people compared to what we're seeing in the general population. And the message from the health regulator has been that this is not figures that would be unusual in the general population.
Right. Thank you, Lucy. And of course, we'll look at what's happening in the UK and why they've taken a different decision. Lucy Huff, our correspondent out there in Brussels. Now, more countries around the world are suspending the use